Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
All right, welcome back to the Deep Dive. We are ready, as always, to take on a pretty complex topic that we know you guys are out there wanting to learn about, but don't always have time to read all those articles and really dive into the weeds. So we're doing it for you. And today we're looking at Cushing Syndrome.
Sounds good.
So, lots of great material here. And one of the things that we see right off the bat is that Cushing Syndrome is a hormonal disorder. It basically means your body has too much of the hormone cortisol over a long period of time. And that can either come from your body just producing too much cortisol on its own, or it can be a result of taking corticosteroid medications for an extended period of time.
Yeah, and it's not like a minor thing.
Right.
Like we see some pretty serious risks associated with the high cortisol levels, things like weight gain, high blood pressure, even type 2 diabetes and osteoporosis. So definitely something you want to get taken care of.
Absolutely. And that's what we're here to do today, to kind of break down the essentials of Cushing syndrome, look at who is most at risk, what actually causes it, the key symptoms to look out for, and of course the treatment options, all based on the research that we've done here, try to make it easy for you guys to understand.
This sounds good.
Okay, so let's get into it. If we look at who might be at risk of developing Cushing syndrome, the research points to a few specific groups. What are some of the demographics that stand out?
Well, the first thing is age. While Cushing syndrome can happen at any age, it's most often diagnosed in adults between 30 and 50. And then there's gender. Women are more likely to be diagnosed with it, particularly with Cushing's disease, which we'll get to a little bit later. But it's important to note that even though it's less common, children can develop Cushing syndrome too, and sometimes it's associated with slower growth.
Okay, so age and gender are definitely factors. But beyond those sort of general groups, who are some of the individuals who might be at higher risk?
Well, if you think about what cortisol does in the body, it's not surprising that people who take corticosteroid medications for a long time, like prednisone, dexamethasone, hydrocortisone, those are all examples that are at a higher risk. These medications are often prescribed for things like asthma, lupus, rheumatoid arthritis, or to prevent organ rejection after a transplant. And because they basically mimic the effects of cortisol, taking them in high doses for a long time can lead to something called exogenous Cushing syndrome.
Okay, exogenous meaning it comes from an outside source.
Yeah.
In this case, the medication. Makes sense. What about other groups that are at risk?
Another group is people with pituitary adenomas. These are benign tumors, so not cancerous, that grow on the pituitary gland. And they can cause the gland to overproduce a hormone called ACTH.
And what does that hormone do?
Well, ACTH, which stands for adrenocorticotropic hormone, is the hormone that actually signals your adrenal glands to make cortisol. So when you have too much ACTH, you get too much cortisol, and that leads to Cushing's disease. And as we said, that's more common in women. Then you have people with adrenal tumors. Those can be benign or malignant, but they can directly lead to the adrenal glands producing too much cortisol. And lastly, there's a group of patients with what are called ectopic ACTH-producing tumors.
Ectopic, that's a new one. What does that mean exactly?
Well, it means the ACTH is coming from somewhere it shouldn't be, outside the pituitary gland. Some types of cancer, like lung, pancreatic, or thymic cancers, can actually secrete ACTH, which then leads to higher cortisol levels. It's kind of weird to think about. You have these cancers that are growing for totally unrelated reasons, but they can have this secondary effect of messing with your hormones. It really shows how complex the body's signaling pathways are.
It's fascinating. So we have age and gender, and then these specific medical conditions or medication uses that can increase the risk. Now, you mentioned earlier that Cushing syndrome is relatively rare, but how rare are we talking?
Well, according to the National Institute of Diabetes and Digestive and Kidney Diseases, or NIDDK, which is one of the sources you provided, it affects about 40 to 70 people per million each year. So it's not something you hear about every day, but it's still a significant medical issue.
Right. Not super common, but definitely important to be aware of, especially if you fall into one of those higher risk groups. Let's dive a little deeper into the causes of Cushing syndrome. The research gives us a good breakdown of what are called endogenous causes. What does that mean, and what are some of the main ones?
Right. So endogenous means the cause comes from within the body. And the most common one, accounting for about 70% of cases, is Cushing's disease. As we talked about before, it's caused by those benign pituitary adenomas that make too much ACTH, which then tells the adrenal glands to pump out more cortisol.
Got it. So the pituitary tumor is like the root of the problem.
Exactly. And then about 15 to 20% of cases are caused by adrenal tumors. So these are tumors that actually grow in the adrenal glands themselves. They can be either adenomas, which are benign, or carcinomas, which are malignant or cancerous. And they directly cause the adrenal glands to produce too much cortisol.
Okay, so that one's more straightforward. The tumor's right there in the gland that makes cortisol.
Exactly.
What about that other one we talked about, the ectopic ACTH secretion?
Right, so that one accounts for about 5 to 10% of cases. That's where you have a tumor somewhere else in the body that's producing ACTH, which indirectly increases cortisol levels.
So it's like a chain reaction. The tumor releases ACTH, and that tells the adrenal glands to make more cortisol.
Exactly.
And then, of course, we can't forget about exogenous Cushing syndrome, which is caused by taking those corticosteroid medications for a long time.
Right, and it's important to remember that exogenous Cushing syndrome is actually the most common type overall, and it's different because it's not caused by a problem within the body itself, but rather by something external, the medication.
That's a really important distinction. So we've got a good handle on the causes. Now let's move on to what people often notice first, the symptoms of Cushing syndrome. And the research suggests these symptoms can develop gradually, which I imagine makes it hard to catch early on.
Yeah, absolutely. It can be really tricky to diagnose Cushing syndrome early because those symptoms can be so subtle and come on slowly. And they're pretty diverse, affecting lots of different systems in the body. For example, if we look at metabolic and physical changes, unexplained weight gain is a common sign. And it's not just any weight gain. The fat tends to accumulate in specific areas like the abdomen, the face, which can become round, giving that moon face appearance, and the upper back, where it can form what's called a buffalo hump. And what's interesting is that this often contrasts with thinner arms and legs because of muscle loss.
So you might see someone with this unusual weight distribution pattern.
Right. And there are some other pretty noticeable physical symptoms too. Like the source mentions these purplish stretch marks or striae that can appear on the abdomen, thighs, and arms. And that happens because the excess cortisol actually thins the skin and makes the blood vessels underneath more fragile. And then wound healing can be delayed, and people often experience muscle weakness and loss of muscle mass. So everyday activities like climbing stairs or even just standing up can become difficult.
I can see how that would be debilitating.
It is.
Yeah.
And then there's osteoporosis, which weakens the bones and makes you more prone to fractures, especially in the spine, ribs, and hips. And on top of all that, many people just feel constantly tired and weak, so even simple tasks can seem like a huge effort.
Wow, it really sounds like it takes a toll on your whole body. What about effects on the heart and blood vessels and on metabolism?
Well, high blood pressure is a really common problem, and if it's not controlled, it can lead to more serious things like stroke, heart attack, or heart failure. And on the metabolic side, we often see insulin resistance, which can then progress to type 2 diabetes. And there are also elevated levels of cholesterol and triglycerides, which increase the risk of atherosclerosis and other heart problems.
So it's not just the visible changes, there are some serious internal risks too. The research also mentions effects on the brain and mental health. What are some of the key things to watch out for there?
The impact on mental and emotional well-being can be really significant. Depression, anxiety, and mood swings are common, and that can lead to social withdrawal and isolation. And many people also have problems with thinking and memory, like difficulty concentrating or feeling like they have brain fog. Sleep is often disrupted too, with insomnia or excessive daytime sleepiness.
It sounds like it can affect your whole life, physically, mentally, emotionally. And the research also touches on hormonal and reproductive symptoms. What should we be aware of in those areas?
Yeah, so in women, irregular or absent periods are common because of the disruption to the balance of estrogen and progesterone. And some women might experience hirsutism, which is excess hair growth on the face and body. That's because of higher levels of androgens, which are male hormones. And in men, we see things like decreased libido and erectile dysfunction, which are often related to lower testosterone levels.
So a wide range of potential symptoms, which makes sense given how widespread cortisol's effects are in the body. Now, we talked about the causes, but let's really drive home that distinction between exogenous and endogenous Cushing syndrome.
Absolutely. The key issue in both types is that the body is exposed to high levels of cortisol for a long time. But with exogenous Cushing syndrome, which is the most common type overall, the excess cortisol comes directly from taking those corticosteroid medications. They essentially mimic cortisol and suppress the body's natural production of the hormone.
So it's like the medication is doing the work of the adrenal glands.
Right. But with endogenous Cushing syndrome, the problem is that the body is producing too much cortisol on its own. And that can be caused by a pituitary tumor that leads to excess ACTH, an adrenal tumor that directly churns out cortisol, or an ectopic ACTH-producing tumor somewhere else in the body.
So that distinction is really important. Is the extra cortisol coming from an outside source, or is the body itself making too much?
Exactly.
Now, the research briefly mentions why early diagnosis of Cushing syndrome is so important. What are some of the complications that can arise if it's left untreated?
Well, this is where things get really serious. If Cushing syndrome isn't diagnosed and treated, it can lead to some pretty severe, even life-threatening complications. One of the big ones is severe osteoporosis, where the bones become so weak that they're easily fractured, especially in the spine. And that can lead to loss of mobility and a lot of pain. You can also have severe muscle wasting, which makes even simple daily tasks incredibly difficult. And there's a much higher risk of cardiovascular problems, like stroke and heart failure, because of that uncontrolled high blood pressure. And then there's the risk of severe diabetes and all the complications that come with it, like nerve damage, kidney problems, and vision loss.
So untreated, it can really affect every system in the body.
It can, and because cortisol suppresses the immune system, people with untreated Cushing syndrome are also more susceptible to infections, and their wounds heal more slowly. And even after treatment, the adrenal glands might not bounce back right away, so some people might need lifelong hormone replacement therapy to prevent adrenal insufficiency.
So early diagnosis is key to preventing these serious complications. If someone suspects they might have Cushing syndrome, what's the process for getting diagnosed?
Usually it starts with confirming whether there's actually an excess of cortisol in the body. And there are a few tests that doctors use for this. One is the 24-hour urinary-free cortisol test, which basically measures how much cortisol is excreted in your urine over a 24-hour period.
Makes sense.
Yeah. And then there's the late-night salivary cortisol test. Normally, your cortisol levels drop way down at night, but if you have Cushing syndrome, they stay high. So they take a saliva sample late at night to check that. And another test is the dexamethasone suppression test. Basically, they give you a small dose of dexamethasone, which is a synthetic cortisol-like drug, and then they measure your cortisol levels the next morning. In a healthy person, the dexamethasone would suppress cortisol production. But in someone with Cushing syndrome, it doesn't have the same effect, so their cortisol levels stay elevated.
So those initial tests are all about seeing if there's too much cortisol floating around.
Right. And once that's confirmed, the next step is to figure out what's causing it. And one of the key tests here is the ACTH blood test. It measures the level of ACTH, which, as we discussed, is the hormone that stimulates cortisol production.
Right, that hormone from the pituitary gland.
Exactly. So if ACTH levels are high, it suggests that the problem is either in the pituitary gland itself, like with a pituitary tumor, or it could be an ectopic tumor somewhere else that's secreting ACTH. But if ACTH levels are low, it usually points to the adrenal glands as the source of the problem, which could be an adrenal tumor. And then they usually do imaging tests like an MRI or CT scan to try to locate the tumor, whether it's in the pituitary, the adrenals, or somewhere else.
So the imaging helps pinpoint the source of the problem.
Exactly. And sometimes if the imaging isn't clear, especially if they're trying to find a small pituitary tumor, they might do a more specialized test called inferior pituitary sinus sampling, or IPSS.
That sounds pretty intense. What's involved in that?
It is a bit more specialized. Basically, they take blood samples from the inferior pituitary sinuses, which are veins that are located very close to the pituitary gland, and they compare those samples to blood taken from somewhere else, like your arm. And they're looking at the levels of ACTH in those samples. If the ACTH is much higher in the samples taken near the pituitary, it pretty much confirms that the excess ACTH is coming from a pituitary tumor, which means it's Cushing's disease. But if the levels are similar in both samples, it suggests the excess ACTH is probably coming from an ectopic tumor somewhere else.
That's really interesting, a very precise way to figure out where the problem is coming from.
Yeah.
Now, once the diagnosis is made, what are the treatment options?
The treatment really depends on the underlying cause. Medications are often used to manage cortisol levels. Some examples your sources mention include ketoconazole, metirapone, and mitotane, which all work to reduce cortisol production in the adrenal glands. There's also a drug called osilodrostat that inhibits cortisol synthesis, and mifepristone, which blocks the effects of cortisol in the body and can be helpful for people with type 2 diabetes as well. And specifically for Cushing's disease, there's a medication called pasireotide that can help lower ACTH levels.
So there are a few different ways to tackle those high cortisol levels.
Right. But often surgery is also a primary treatment option. For Cushing's disease, the goal is usually to remove the pituitary tumor, and they do that through a procedure called transsphenoidal surgery. If the problem is an adrenal tumor, they might do an adrenalectomy, which is the removal of one or both adrenal glands. And if there's an ectopic ACTH-producing tumor, the goal is to remove that. In some cases, they might use radiation therapy, like stereotactic radiosurgery, to target a pituitary tumor, especially if surgery isn't a good option. And then for exogenous Cushing syndrome, the treatment involves gradually tapering off the corticosteroid medication under close medical supervision, which allows the adrenal glands to recover and start producing cortisol normally again.
It sounds like it often takes a team approach, endocrinologists, surgeons, maybe even oncologists, depending on the cause.
Definitely.
Now, the research also mentions some natural approaches,
Sure.
but it's important to emphasize that these are meant to support medical treatment, not replace it, right?
Absolutely. Natural approaches can be helpful alongside conventional medical treatment, but they can't cure Cushing syndrome on their own. Your source mentions a few categories of natural approaches. There are adaptogenic herbs like ashwagandha, rhodiola, and holy basil. They've traditionally been used to help the body deal with stress and potentially regulate cortisol levels. They might offer some support for fatigue and hormonal balance, but it's super important to talk to your doctor before using them, especially if you're already on medication for Cushing syndrome.
Good advice.
And then there's the anti-inflammatory diet, which focuses on whole, unprocessed foods and avoids things like processed foods, refined carbs, and too much sugar. This kind of diet can help reduce inflammation, which is often linked to cortisol imbalances, and it supports overall metabolic health. And your sources also mention magnesium and vitamin B5 supplements, highlighting their roles in supporting adrenal function, calming the nervous system, helping with energy production, and supporting the body's stress response. They even point out which foods are good sources of those nutrients.
So those supplements can help address some of the underlying deficiencies that can contribute to the problem. And then there are lifestyle factors like sleep and stress management.
Right, those are huge. Getting enough sleep is crucial because Cushing syndrome often messes with sleep patterns. So good sleep hygiene is essentialist. Things like having a consistent sleep schedule, limiting screen time before bed, and practicing relaxation techniques can all help. And melatonin supplements might be useful for some people to help regulate their sleep-wake cycle. Stress is another big factor because chronic stress can make those cortisol imbalances worse. So things like meditation, yoga, deep breathing, and mindfulness can be really helpful for naturally lowering cortisol levels and improving emotional well-being. And regular physical activity, as tolerated, can also help with stress relief and improve overall health.
So these natural approaches are all about supporting the body's own healing processes and managing symptoms, working in conjunction with conventional medical treatments. The research also specifically mentions a Cushing's syndrome diet. What are some of the key recommendations there?
The diet recommendations for Cushing syndrome really emphasize nutrient-dense foods that support recovery from the effects of prolonged high cortisol levels. And the source highlights some specific categories of foods.
Which are?
Protein-rich foods like chicken, fish, eggs, tofu, and beans are super important for rebuilding muscle mass, which you can lose because of high cortisol. Calcium and vitamin D are crucial for bone health, especially to prevent osteoporosis, so things like dairy products, leafy greens, and salmon are good choices. And potassium-rich foods like bananas, avocados, and spinach help balance electrolytes, which can be thrown off. Omega-3 fatty acids, which you find in fatty fish, walnuts, and flax seeds, have anti-inflammatory benefits and are good for heart and brain health. And then there are antioxidant-rich foods like berries, citrus fruits, and green tea, which help boost the immune system and aid in recovery.
Okay, so lots of good things to include in your diet. What about foods to avoid?
Well, refined sugars are a big one. They can make insulin resistance worse, increase inflammation, and contribute to weight gain. So that means cutting back on sugary drinks, pastries, processed snacks, and all that good stuff. Processed and fast foods are also best to avoid because they're often loaded with unhealthy fats, preservatives, and a ton of sodium. And high sodium foods can worsen fluid retention and high blood pressure, both of which are common with Cushing syndrome. So you'll want to limit processed meats, canned soups, salty snacks, and things like that.
So it's basically a healthy diet that focuses on whole, unprocessed foods and limits sugars, unhealthy fats, and sodium. That sounds like good advice for anyone, really, but it's especially important for people recovering from Cushing syndrome.
Exactly.
Well, this has been a really thorough deep dive into Cushing syndrome. To wrap things up, What are some of the key takeaways you want our listeners to remember?
I think the most important message is that Cushing syndrome, while serious, is definitely manageable, especially if it's caught early and treated properly. Whether it's caused by medication use or an underlying tumor, getting those cortisol levels under control is key to preventing those long-term complications and getting your health back on track.
Absolutely. And if anyone listening recognizes some of the symptoms we talked about in themselves or someone they know, the best thing to do is talk to an endocrinologist. They can do a full evaluation and come up with a treatment plan that's right for you.
I agree completely.
And on that note, here's a final thought for you to chew on. When you think about how complex hormones are and how they affect so many different systems in the body, it really makes you wonder what other seemingly unrelated symptoms we experience could actually be tied to hormonal imbalances. It's definitely a reminder to pay attention to our bodies and seek medical advice when something feels off, even if we can't quite put our finger on it.
Yeah, that's a good point.
So thanks for joining us for this deep dive. We'll see you next time.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.